Hi. Case study 4. Hypothesis. Application of a direct fascia technique to the client with chronic condition leads to a longer lasting results after one treatment. The reason this hypothesis was chosen is the following. Though deep tissue massage treatment was working best so far in the clinical practice, however, the therapist would like to see if a direct fascia technique will make a bigger difference in an overall fascial chain, decrease pain, and improve energy transition. Also, it has been observed over the years of practice that clients tend to skip on the following up appointments and come only if the chronic symptoms are aggravating. Therefore, one session treatment was chosen for the experiment to see on the effectiveness of it. Direct fascia technique was chosen for the following reason. We know it is highly effective in dealing with chronic condition, and it's good at decreasing pain and restoring a range of motion. The client provided a health history and approved a physical assessment and gave a consent to her treatment. She is a 38-year-old female with no particular history of injuries other than a history of flat feet at birth, which was corrected orthopedically in childhood. Shot of epidural during two of her deliveries, however, there was no C-section. The client is working many hours at the computers, experiencing discomfort and pain on a regular basis, and so we went right to the structural assessment. From a structural point of view, the person was exhibiting classical slouching from the office work duties. The tension lies in the superficial front line, superficial back line, and superficial deep line. A slight anterior pelvic tilt and a slight inward rotation of the pelvis. The lines of tension are present starting from the plantar fascia, continues through the transverse and lateral intermuscular septa, up through the fascia lata, lateral intermuscular septum of the thigh leading to ischial tuberosity and gluteal muscle, specifically piriformis, internal rotators, and glute medius bilaterally. The tension continues through the thoracolumbar fascia, the upper and medial trapezoid region, and very restricted at the occipital region of the neck and head. From the anterior point of view, the line of tension comes from the front of the pelvis, iliac crest region, aka psoas fascia, inguinal ligament, the pecs, shoulders, and anterior neck region. The skin and muscle tissue feels tight and rigid at the mid-back, right at the mid-back and upper back. The local listening has led the therapist to identify a few areas of lesion. One was towards the upper back and between the shoulder blades, the posterior ribs, and the other led to the axial line of tension. The examination of 4 diaphragms and rib cage movement showed that the atlanto-occipital and cervicothoracic and thoracolumbar diaphragms are holding tension. Also the lumbar sacral diaphragm is tensed up anteriorly and at the internal rotator region posteriorly. The normal compensatory pattern is also observed left-right for the diaphragms. The ribcage movement is slightly reduced during exhalation on the right. Pelvic diaphragmatic listening, the sacral rocking, indicates some tension at the upper thorax during the breathing. The beneficence and non-maleficence principle has been satisfied as the client is a good friend and is helping a therapist with their case study. Also, all the risks and benefits of the osteopathy treatment has been explained to the client, and there is no potential harm to client's health as we went through the treatment plan together. The subject knows what to expect in the treatment session. Biological determinants. The main 2 lesions associated with our clients are the following. The psychosomatic lesion, aka facing stressors from 50 hours of mentally responsible management job, leading to body's fascia to to be in a state of constant autoneurosympathetic firing, resulting in a decrease in fluid flow and lubrication of the fascia system, thus resulting into the physiological lesions of chronically painful mid-back and upper shoulder and neck region, so like a stress response. Things that may improve our client's healing is more time spent taking hours from work, as well as consistent attendance of the health centers who can focus on physical rehabilitation, osteopathy, manual therapy, and even getting a psychological and or spiritual rehabilitation from all the stressors caused by the management job. Our study was based on one osteopathy treatment with a focus on one particular technique, the direct method of applying pressure, which follows the path of most resistance. As a reminder, the direct myofascial release technique engages the restrictive barrier, and the tissue is then loaded with the constant force until tissue release or relaxation occurs. And then we move to the next barrier until lets go, and so forth. To be fair to the client and to not overstimulate their reaction, some soft Swedish massage techniques are used, effleurage and petrissage. They applied briefly after treating a limb to soothe the rather aggressive initial technique. The area of application of the direct technique are all along the fascial lines of tension, some superficial front line and superficial back line, and partly superficial deep line. Time frame. Overall treatment time is 100 minutes, 15 minutes for assessment, 60 minutes for using direct techniques, then the last 25 minutes are used for the massage techniques, and the last 10 minutes for reassessment. Treatment is performed in accordance with the standard COVID safety guidelines. Tools used to measure the results of the study are reassessment, through Gillette's test, sacral rocking, passive range of motion of neck, hips, and legs, posture assessment, the 4 diaphragm assessment, the rib cage movement. Also, hand is used to measure the 4 T's, tone, temperature, texture, and tenderness. To measure the longevity of the effect of the treatment, time frame of 3 weeks is used to check with the client about her state of health. Improvement would be considered significant if they differ from the results of a regular massage treatment. The results. The results have shown improvement in the following. Gillette's test showed better S2 movement in relation to PSIS. Sacral rocking was felt during the inhalation and exhalation. The C-spine has gained 20 degrees in bilateral side flexion, improved forward flexion and rotation by 15 degrees bilaterally. Leg flexion is performed passively, and there was a significant improvement in flexion, internal and external rotation of the hip. Diaphragmatic movement performed smoother movements than before. The 4 T's show more redness, higher temperature at the lesion sites, a better elasticity, and a more natural tonicity than before. Subjectively, a client felt much better and happier. The treatment has definitely freed up a lot of tensional energy after working at the diaphragms, because the client reported later that she feels like doing exercising and spending more time playing with kids and doing chores. 3 weeks afterwards, and she feels stable, meaning that the chronic pain symptoms are showing more improvement than that of a singular massage treatment done previously in our history. Excuse me. Now, regarding her personal treatment plan, client has approved the treatment plan proposed by the therapist, satisfying the partnership principle of manual osteopathy. As for our immediate goals, we have determined to spend 3 sessions, of which the first one is meant to properly assess all of the fascia chain lines and diaphragms, the passive range of motion, the ribs, mobility, the sacral rocking, and focus on the lesions of the superficial front line and superficial back line. Then reassessment. During the second treatment, we can focus on the superficial deep line, particularly the anterior neck, ribs, diaphragms, iliopsoas, IT band, the frontal tibial lateral fibular compartment. Then reassessment. On the third session, we can focus and go through the superficial front line, lateral line, and arm lines to better address the overall stability of the client and resolve all of the lesions found. Then reassessment. All in all, we have come up with a plan to work towards client's proper alignment and even discussed the possibility of attending other referred places such as physio clinic to better integrate our holistic approach. This decision was based on the partnership principle of osteopathy manual practice. The appointments would be held once a week for 3 weeks, 175-minute treatment per session, with the first minutes taken for the assessment purposes and the last 10 minutes for reassessment. The client is asked to pay for hour-long treatment as they are the subjects for the educational case study. The cost-benefit analysis shows that this is the win-win case, as she was already determined to do something about her health. As for the therapist, this benefits him in the sense of gaining experience and practical utilization of a new approach in dealing with the chronic tension problem holistically. The result of the case study clearly indicates that there is a considerable improvement in the client's health, specifically in the lessening of the tension along the fascial line, which led to freeing up more energy, better posture, and restoration of the range of motion. The goal was to see if a direct technique of osteopathy approach can be used effectively in dealing with the typical chronically sad office desk clients. In the end, it was surprising for both of us to see the immediate improvement. The therapist does acknowledge there are limitations in techniques used for our clients' issues. However, the point was to see the effectiveness of the singular direct method fascia technique. Thus, if we incorporate other techniques into the picture, we will potentially get an even better result. Also, there are limitations to the time frame given to use fascia techniques because at times it takes at least 90 to 120 seconds to be able to feel the give in the initial barrier at the lesion, thus affecting the timeliness of the procedure and perhaps even reducing the willingness of the patient to find that much free time to commit to. We can also assume that other factors would be addressed more thoroughly, such as psychosomatic lesion that the client is going through with her management job, which keeps bringing up patient back to the sympathetic nervous firing and the escalation and even debunking the progress we have made at the treatment. This means that our 3 weeks interval of improved state of being can be affected with unforeseeable factors like more work stress or unregulated muscle memory at the office desk or poor ergonomic setup. Therefore, the short-term goal for our client is to maintain the balance of the pelvis, spine, and neck by working on proper posture exercises in order to correct the head-forward posture and regain proprioception of one's position in space. And the long-term goal is to address overall well-being, addressing other lesions listed above by possibly referring her to other specialists in order to restore her health. Looking at the tensegrity principle, the changes that are being produced locally will affect the rest of the body. In our case study, we saw how balancing the four diaphragms has led to much better state of well-being through the body even after a 3 weeks period. So that is a good improvement. For further studies, the therapist would most likely choose a greater sample size of participants. A minimum of 5 would be preferred, with similar lesions, and examine each one over the period of 1 year to be able to see effectively if the improvements of the corrections are temporary and how long they do actually last. The role of osteopathy is crucial in the recovery process of the client. However, it is within the scope of practice of the manual practitioner to seek the integral approach towards healing, and therefore other healthcare practitioners may play a crucial role or part. Um, and it is according to the holistic philosophy with manual osteopathy. With the lesions that are present in our client, it is necessary, therefore, to collaborate with medical doctor, physiotherapist, psychologist, or priest to achieve the desired result. It is also important to remind our client once in a while to work on her breathing techniques and maybe take a holiday from work. Conclusion. In this case study, the therapist has gained significant clinical knowledge of assessment, palpation, observation, and treatment skills. We have put to the test the osteopathy technique that can be universally useful and effective in treating the patient with chronically bad posture and constant pain in the mid-upper thoracic spine. The lesson is clear regarding the effectiveness of the direct fascia technique in the collaboration with the massage used in regaining the functional range of motion, better balanced pelvis, diaphragms, a better mobility of the ribs, and finally a better transmitted energy force throughout the body as evidenced after the time period after the initial treatment. The experience that has been gained here translates into the toolset of knowledge, allowing the therapist to use it freely for the future clinical practice.